Guys, welcome back to the Fighter Method. If you are just joining the live series, we have been talking about chronic pain and inflammation, and we are going to end our live series with some facts. So we're going to do a Fact Friday, and then I'm going to kind of test your knowledge of what we've been talking about or what you've learned from even today. And yeah, so that's that. But first, my fun cup of today is my spirit animal, the panda. I would take a sip of my beverage, but it is ridiculously hot. So we are going to start with the fibromyalgia facts. Little known facts, or maybe some of you do know, in hopes that some of this information you can take back to your loved ones, your friends, your family, whatever, so that you can help them get a better understanding of what a day in the life of someone with chronic pain is. So fact number one, more than 6 million people in the United States have fibromyalgia, which makes it one of the most common pain conditions. The second fact is that twice as many women as men get fibromyalgia. Yes, men can get fibromyalgia too. The ages that it typically strikes at is between the ages of 30 and 55. The next fact is people with fibromyalgia tend to have a very hard time finding a doctor that is knowledgeable on fibromyalgia and how to treat it, and also believes that fibromyalgia is an actual disorder. The next fact, fibromyalgia tends to run in families. It is often exacerbated by a trauma, physical or emotional, certain illnesses, accidents, and certain mental health issues. There has been a direct link between fibromyalgia and people who have autoimmune diseases and osteoarthritis. The next fact is some people with fibromyalgia experience heart attack-like chest pains, which is pretty common. The fun fact is if you have fibromyalgia and it is keeping you from being able to work, fibromyalgia is actually a disability that Social Security disability will cover. You may have a lot of extra legs and loops that you have to go through, but as of 2012, the Social Security Administration began to recognize fibromyalgia as a possibly debilitating and a degenerative disease. Now, how is fibromyalgia diagnosed? So at one point, it used to be diagnosed by the trigger point test or the tender points test. Now it is diagnosed using the wide pain index and the symptom severity scale. So what the wide pain index is they want to know how long you've experienced that amount of pain on a scale of 1 to 10. And then they want to know how long has that severity been there on a scale of 1 to 10. So the total number of the scale would be, of course, 20. So the higher you are up, the more likely it is that you have a chronic pain disorder. So before this method was adopted, they did tender points, and the tender points are the same on both sides of your body. So the spots that they poke on would be your shoulder blades, between the tops of your shoulders, the back of your head, so that the nape of your neck, the same spot toward the front, your upper chest, your elbows, your inner knees, in your hips. Um, and that is an awful exam to have to go through, especially if you're in the middle of a fibro flare while you're trying to get diagnosed. Um, so the super fun fact is that fibromyalgia was actually discovered in the early 1820s. Um, it was fibrocystis then, and it evolved to have the title fibromyalgia. One of the other super common symptoms with people that have fibromyalgia or chronic pain disorders is that depression kind of comes with it. Um, and living in that state of chronic pain, if you're in a situation where you don't have a strong support system, it could be a lot on your mental. So we talked a little bit this week about symptoms of inflammation and how that plays a role in our bodies. So we're going to talk about some of the symptoms of fibromyalgia. And as I list off the symptoms, I want you to take a minute and ask yourself, if you've been experiencing chronic pain, how many of these things have you experienced out of the list of fibromyalgia symptoms? So the first symptom is chronic muscle pain, muscle spasms, or tightness. The next symptom is moderate or severe fatigue and decreased energy. The next symptom is insomnia or waking up feeling just as tired as you felt when you went to sleep. The next one is stiffness upon waking up or after staying in one position for too long. The next one is difficulty remembering, concentrating, or performing simple mental tasks. That's referred to as fibrofog. And abdominal pain, bloating, nausea, constipation, tension or migraine headaches, jaw and facial tenderness, sensitivities to odor, sounds, lights, medications, heat and cold, numbness or tingling in your face, your hands, your feet, or your arms, a feeling of swelling without actual swelling in your hands and feet. So the thing about fibromyalgia symptoms, as we just went down the list of possible symptoms you could experience, is the symptoms can intensify based off of what you're doing. So if by late afternoon, you had done a lot of ripping and running, by that evening, if you felt like you might have gotten hit by a Mack truck, but you felt good in the morning, that's how it's like a slippery slope of a very delicate balance. So how do you approach having the conversation with your family about what it is that you're going through on a day-to-day basis, right? First, before you do anything else, you dispel the disbelief and you let them know that what you're feeling is in fact actually real. And then you educate them about your chronic pain disorder. You talk to them about what fibro is and how it affects you. You explain to them that the best analogy when trying to explain to someone what fibromyalgia feels like is it's like your body uses more energy than it can produce. So you're always zapped. It's like being in a constant state of having the flu. That would be a super good way to describe what it's like to have fibromyalgia. Um, you talk to them about how it is super important for you to prioritize listening to your body. Um, the unfortunate part about living with a chronic pain disorder is that you never anticipate when it's going to hit. So you have all of these plans to do all of the things, and then the day of, you wake up and you don't feel like you can get out of bed. It's very unpredictable. Um, Even if you schedule these things months in advance, they need to understand that what's going on in your body is a ticking time bomb of unpredictability. You want to talk to them about things that they could do to help and actually ask for that help. Because if you never ask and you're always overdoing, how do you ever get to a place where you can have one less day of being in pain, right? So you ask for the things that you need. But in that same token, you have to respect the fact that whomever you ask could also be having a bad day or could also be dealing with things. So you have to ask for help, but you also have to respect their no in the event that they have other things that happens. I'm sorry. All right. Hi, Bug. Hi, Valentine. So, you have to be specific about what it is that you need. Um, and a lot of your confusion with your friends and family, your loved ones, is that it's not that they don't want to learn about what's going on. A lot of the times is that they don't know what questions to ask. So you finding a way to facilitate the conversation and educating them would help you overall in how you cope with being in chronic pain. So we're going to do um, a couple true or falses. Hold on, I have a question. How does one show support if they can't physically support you? Um, so being there to listen, um, even if they don't want to say anything at all. Sometimes just having the support in the room or having the empathy to understand that they're not in a good space. I know that I don't always want people under me when I don't feel well. And I don't really want people asking me 96 times a day how I'm feeling. But knowing that they reached out to go, how are you doing? Means a whole lot to someone who lives in chronic pain. Remember, we talked about how living with chronic pain and depression kind of go hand in hand. And so just checking in with them on their mental state, like how are you doing? And letting them know that you're genuinely there to listen and that you'll hear them. So, true or false, we know how fibromyalgia is caused. If you answered true, it is not correct. So it is unknown what causes fibromyalgia. It could be family history, exposure to stressors, um, mental health struggles, infections, illnesses, um, stuff like that. So many patients with fibromyalgia have sleep disturbances. We talked about that. And what that means is now they have the chronic fatigue. And we talked about earlier this week, with chronic fatigue comes inflammation and pain. So that is your chronic pain cycle, that is difficult for people with fibromyalgia to get out of, because your body is always in a sense of alert. Fibromyalgia and depression appear to be related. True or false? The answer is true. Both illnesses share the same risk factors and the same medications when going to treat either one of those. Um, True or false, fibromyalgia stimuli cause pain? The answer is true. We talked about being in a constant state of alert. There's a disconnect with how our body and our neurotransmitters communicate. And so people with fibromyalgia, the brain center kind of heightens the pain without knowing why it's heightening the pain. Fibromyalgia is a woman's disease. That is false. About between 80 and 90% are women, but men are also affected by fibromyalgia, and it is also middle adult years when they get diagnosed. There's no blood tests to look for or diagnose fibromyalgia. And our last couple facts. We learned earlier earlier in the week, we talked about mental health and anxiety and inflammation and how that all ties in, right? You are better off if you are someone who suffers from chronic pain, asking for the support that you need than trying to bear it alone. This is coming from a warrior who struggles with mental health because I'm in chronic pain. And then I get the runaround from doctors. Just understand that you're not alone. And I'll keep telling you this every time you see my face. You're not alone. Someone does get it. I get it. If you have any questions, please feel free to DM me, reach out. I would love to have the conversation with you and try to find the ways to get you relief. If you want to catch the replay will be on my YouTube channel, The Fighter Method. While you're there, be sure to like, comment, and subscribe. It will also be pinned in Facebook and on Instagram, IGTV. I appreciate you guys hanging out with me this week for this live series on chronic pain and inflammation, and ending it with me for the finale on fibromyalgia. Please stay safe out there. Start the conversations with the people that matter so that you can get the support that you need. And if you can't start those conversations with those people, please start the conversation with me so I can help you get the support that you need. See you next week.